Hello everybody, I'm Dr. Nisarg Aravindan. I'm an MD in Community and Family Medicine from AIIMS Rishikesh. I'm currently a practicing family medicine physician and a public health specialist. And I'm here today to discuss with you all a few topics in PSM. So without further ado, let's get started. So today we're going to be discussing a little bit about STEP image advantage series for PSM. We're going to have a series of about 30 images where we'll see the most commonly used images for the exams, and you will also be able to get a clear idea on what to expect in the coming exams as well. So the first question which we'll be looking at is, order the studies as per their increasing strength of evidence. So we have four main headings here. A is meta-analysis, B is RCT, C is a cohort study, and fourth is a case control study here. Now we have to see on which we need to order as 1, 2, 3 and 4. This is a very common pyramid of evidence which we need to be well aware of. So just by seeing these four options, we know that meta-analysis is going to be the number one option because that is highest among this specific image, followed by which we have randomized controlled trials. Then there's going to be a cohort study which is going to be third in the list here, and followed by case control study which is going to be fourth. So the option that corroborates with this specific order is going to be option B. So we have option B here, which is 1A, 2B, 3C and 4D as well. So that is the option that we have. So moving on to the next one, this is a medical certificate for cause of death. This is also something where we need to be learning. Even when you're in your residency, you would be filling out many death certificates as well. So this actually helps you in real life. So the question is, a 34-year-old female met with an accident while crossing the road and dashed by a car and had a crushed injury to the thorax 2 hours ago. Patient was admitted to the hospital in shock, showing profuse hemorrhage. Patient died in half an hour after admission due to hemorrhagic shock. Being a medico-legal case, body was sent for post-mortem. Post-mortem findings were suggestive of multiple rib fractures and hemorrhagic shock due to rupture of lungs and internal organs of thorax. What is the antecedent cause? So we can see here what an antecedent cause means. So it is basically morbid condition, if any, giving rise to, due to, or as a consequence of the above cause, stating underlying conditions last. So among all of this, the option that is the antecedent cause will be the crushed injury to the thorax, following which there would be a hemorrhagic shock. So this is the correct option. So a victim was a pedestrian dashed by a car, which is option, the point number C here. B would be the antecedent cause, which is crushed injury to the thorax, and option A, which is the immediate cause, would be the hemorrhagic shock. Next, Q3. If the fifth cup in this apparatus shows bluish discoloration, it's not a discoloration, it's a coloration rather, how many grams of bleaching powder is needed to disinfect 1 imperial gallon of water? So an imperial gallon is basically 455 liters. So this is just a term that they might use to confuse, but if the total gram of bleaching powder which you need here in this case would be the fifth cup into 2 grams, which would equate to 10 grams. So option A would be the correct answer here, wherein you would need 10 grams to disinfect this specific imperial gallon of water. Next, question 4. Residual chlorine is affected by all except A, temperature, B, pH, C, presence of carbonates, D, the contact period. Now, all these variables are defined as what you see as the residual chlorine or the chlorine demand of water. So we have to specify at what temperature and what pH this chlorine is acting on the water. So we need to make sure that the temperature is accurate. So it will affect the residual chlorine, the pH will affect the residual chlorine, contact period will affect the residual chlorine. So the presence of carbonates here is the answer, wherein the residual chlorine is not affected by. So the answer is C. Next, name the instrument. 1, hygrometer, 2, Assmann Psychrometer, C, 6 is maximum and minimum thermometer, 4 is anemometer. The answer to this is an Assmann Psychrometer. So it's an image-based question. once you see this, it's something that you just directly need to answer. So basically, if you compare it with the other images that we have, it would classify in this same range, that you just identify it directly when you see the image. So this is a straightforward question that we have as well. All right. Moving to question number 6. What is the instrument called here in this case? Option A, Salter-Harris scale. Option B, Shakir scale. C, Morse scale. D, Salter scale. This is a Salter scale wherein we can measure a maximum of 25 kgs, as you can see here in this image. Salter scale is used to check for the weight of the baby to a maximum of 25 kgs. Salter-Harris scale is completely different. It is to assess the amount of fluid loss in the baby. So Salter scale is the answer in this case. Okay, so this is a sound recording device. So this relevant question here is the sound level of 65 decibels during the day is the limit for. You can see it's a 68 decibel reading here in this. That's why this question has been asked. So either it's in the industrial area, in the residential area, in the commercial area, or in the silent zone. So the answer for this is, during the day it is 65 decibel, during the night it's 55 decibel for commercial areas. So the answer is commercial areas of 65 decibel sound limit during the day. Next, question 8. Aerobic oxidation and anaerobic digestion occur. So basically, you guys all know this is a septic tank, correct? So in the septic tank, the inside of the tank has no access to oxygen. So that means the inside of it will undergo anaerobic digestion, whereas the outside, the soil here has exposure to the external air, wherein it can undergo aerobic oxidation. So aerobic oxidation will occur outside the tank and anaerobic digestion occurs inside the tank. So the correct option is option B. Next, question 9. This kit is used to detect what? This is a salt testing kit, and it's pretty simple in that we add a certain nutrient in the salt itself to increase its availability for us in our body as well. So it's not sodium, you don't need to use that. For adulterants as well, nope, not as sulfur as well. So the correct answer is iodine. So it's used to test iodine, and this gives a specific color when you apply this specific MBI kit for detecting iodine in the salt. Next, question 10. What is the regimen used for the fractional dose of this vaccine? So this is IPV, all right? So we're going to be using the fractional dose. So this is going to be a FIPV. Now, as per the latest guidelines, the answer is that we give it at 6 weeks of age, 14 weeks of age, as well as at 9 to 12 months of age. So the correct option is C. So 6 weeks, 14 weeks, and 9 to 12 months of age of the child. So keep that in mind. The correct option is C. Next, question 11. How many doses and international units of this solution is given as per the National Immunization Schedule up to 5 years of age? So this is vitamin A. Now we know that below 6 months of age, we give 50,000 international units. Between 6 to 12 months, we give 1 lakh international units, and above 1 year of age, we give it as 2 lakh international units. And the first dose is given at 9 to 12 months. So you would give it 1 lakh unit, and then subsequently every 6 months, you give 2 lakh units. So that totals up to 5 years of age, we end up giving 9 doses and 17 lakh international units. So the correct option is 9 doses of vitamin A with 17 lakh international units. Next, the topmost item in the ice-lined refrigerator is what? One is OPV, second is hepatitis B, third is a diluent, fourth is a PCV. So we usually put the diluent farthest away from the compressor. So the compressor is where the cold nature of the ILR starts. So the lowest portion of an ILR where the compressor lies is the coldest portion of the ILR. So this would be the coldest and it's furthest away from the lid here, and then this would be the warmest area of the ILR. So, the diluent would be the correct answer. In case the diluent wasn't there, we would have the hepatitis B. So, that would be the correct answer here at the top. Okay. So, basically the logic is that the live vaccines are put in the colder sections, whereas the toxoids or the surface antigens are separately put in the topmost layers. Okay. So, the diluent is the correct answer here. Next, question 13. All of the following would be kept over an ice pack and not in the well, except. That means to say, all of these vaccines are put either inside the well or on the surface. Alright. Now, which one of these is not put just on the surface? Which one of them have to be put inside the well? So, OPV is put on the surface, JE is put on the surface, rotavirus is put on the surface, whereas BCG has to be put inside the well of the ice pack. So, BCG is the correct answer. So, it's heat sensitive, so you need to keep it inside the well of the ice pack. Next, vaccine vial monitor. Which of the following VVMs don't exist? So, VVM2, VVM7, VVM3, VVM30. Alright, so this is a factual question. So, VVM2 does exist, VVM7 does exist, VVM30 exists, and VVM14 also does exist. So, the VVM that doesn't exist is option C, VVM3. Alright, so remember that 2, 7, 14 and 30 exist, whereas 3 doesn't. So, you can mark that up as the option here. Next, shake test is done for all these vaccines except. So, the shake test is specifically done to see which are very cold sensitive. So, if they form crystals, it's no good to use, and the basic logic is that any of the T series especially, so we have T series here which is DPT and DT, so we don't do that for the shake test. So, I mean the shake test is done, whereas we are asking what is not done. So, hepatitis B also, it's part of the pentavalent. So, hepatitis B also undergoes a shake test, whereas the IPV, the shake test is not valid. So, the answer here for this question is option D, which is IPV. Next, question 16. Copper 380A is a second generation IUD. The number 380 stands for what? So, first is A, surface area is present in square millimeters, or surface area is present in square centimeters, length of the copper in millimeters, or the diameter of the copper filament in nanometer. So, this is a pretty straightforward question. That answer is A, which is surface area over which copper is present in square millimeters is what 380 stands for. Next, question 17. Another name for the same contraceptive available in the public sector for Saheli. So, is it Mala D, is it Chaya, is it Nirod or Vatsalya? So, the correct answer is Chaya. Alright. So, this is also Sencruman, wherein this is going to be sold in the public sector. Next, question 18. Which of the following diseases can the insect with this egg morphology cause? So, this are all cigar-shaped eggs. As you can clearly see, they're all separated and they are all in a certain raft-like arrangement. So, they would be the Aedes egg, alright, Aedes aegypti egg. So, Aedes causes dengue. So, the correct option is dengue. Malaria is obviously going to be Anopheles. Japanese encephalitis is by Culex vishnui. Loa loa as well. It's going to be by another mosquito species. So, hence, it's not that either. So, the correct answer is going to be dengue. Next, question 19 is, which disease does this organism cause? First, we identify it. Alright, so this is going to be a mite, which is specifically mite, is going to be the itch mite. So, the itch mite is going to be causing scabies. So, we have the correct answer here. Alright, so scabies is the correct answer which this organism is going to cause. Next, name the purification technique used to prevent this pathology from occurring. First, we need to identify the pathology. So we can see the mottling of the teeth and the yellowish discoloration as well. So this is going to be fluorosis. All right, it's very clear cut. Now, to prevent fluorosis, defluoridation techniques are required. Now, the most famous defluoridation technique that we use is called as the Nalgonda technique. So, option C or option 3 is going to be the correct option in this case, which is the Nalgonda technique. Question 21. This is something that you commonly see in ophthalmology as well. There's an entire classification for this. So, what is the grade of xerophthalmia in this case? So, this is obviously a Bitorch spot. So, as per the classification, the grading, it would be X1B, which is the option B. So, that's about question 21. Next, we have question 22. So, this is an image for few farmers who are economically backward, who have difficulty in walking, which has progressively increased from using no stick for support to using 2 sticks for support over the course of 3 to 4 years during their adulthood. They have what is their likely diagnosis? So, we can see that these are adults who are farmers, who are economically backward. That means they don't have access to very good food or medical services. They have difficulty in walking. That has been of a recent onset of 3 to 4 years, and it's during the course of their adulthood. Okay, so poliomyelitis is usually a childhood onset disease, and it would be progressively increasing, and there would be permanent disability here in that case. And osteoarthritis is more so during the older age groups, wherein they would have some other specific symptoms, as in it progressively increases towards the end of the day. And in rickets as well, they would have other deformities that would also be seen, and rickets is specifically more so during childhood as well. So, what we can consider is lathyrism, wherein they are consuming kesari dal, wherein farmers consume it because it is very cheaply available. It's an adulterant as well. So, they have been progressively undergoing all of this issue, which is going to be the neurolathyrism. That's about question 22, it's lathyrism. Next, question 23. The percentage area under the curve between +1 and +2 z-scores is what? So, we're going to be considering this area. Now, between -1 and 1, it's going to be 68%. So, we can consider that this is 1/2, and between +2 and -2 standard deviation is going to be 95%. So, you're going to be having correct answer as 13.6 for one quadrant here, 13.6 and another 13.6 here, and this entirely is 68, approximately 68%, right? So, the correct answer is going to be 13.6% between +1 and +2. Question 24. Name the country which resembles the following demographic pyramid the most. Okay. Now, we'll just have a look on male and female. So, it's more or less proportional, and we're seeing how much of the proportion of the population they represent on either side. And these are the age groups that are here, that's increasing age groups. Now, if we have a population that is having most of it in the working age group, that's a demographic gift, correct? So, now Japan, as we know, is an aging population, and their pyramid is going to be inverted, correct? Wherein most of the population is aging. USA, it's approximately in that range, but it's a little bit wider than that because they still have a lot of people who are relatively young. For USA, this is the one. Next, for Nigeria, Nigeria has a wide-based pyramid wherein most of it are in the very young age group, all right? So, India here would be the correct option, wherein we are in the late stationary, all right? So, India is going to have many of its population in this area of the working population. Next, question 25. What is the name of this diagram? So, you can see that the number of frequencies are just adding up here. It's called a cumulative frequency diagram. So, here there is a median, there's an upper quartile and the lower quartile. Now, as and when the data keeps getting accumulated, you start joining all these points together to finally reach the total numbers. So, it's going to be 1 plus 2, so it will add up to 3, and then 3 to another 2, so 5. So, it keeps on adding. It's not that it will record each frequency separately, it's cumulating, it's adding up together. So, the answer here would be an ogive, which is another name for the cumulative frequency diagram. So, the answer here is ogive. Next, name this graph. It's a interesting question because by the looks of it, immediately you would be in a position to answer it. Because if you say a box and whisker plot, no, it's not classically related to that. In a bland alternate plot, you will have the specific cutoffs there between +1 and -1 standard deviations if it was a bland alternate plot. It's not a frequency polygon because it's not connecting any of the dots, whereas it does definitely resemble a caterpillar, and this is actually what is a caterpillar plot. So, the correct option is option C, caterpillar plot. Next, this is an interesting question wherein we are seeing the sensitivity versus specificity of a test. So, if you are having one population which is non-diseased and another with disease, so the red is with disease whereas the green is without the disease. So, the question is, what will point A represent in this diagram? So, the point A is starting here, exactly at this point, wherein beyond which all are going to be catching the true positives. So, you're going to take in all the cases that are positive, truly positive. So, you're not going to miss even a single case. So, that what means is it's going to be 100%. Now, if it's 100% of catching all the true positives, we're talking about sensitivity. Okay. So, it's going to be 100% sensitivity, whereas 100% specificity is if you're able to detect all the true negatives. So, option B would be 100% specificity, whereas option A would be 100% sensitivity, means you can catch all the truly positive cases of disease in this case. Now, this specific question is, what study design does this show? So, we have a defined population, and obviously we can read that it is not randomly assigned, and then we check them into exposed and non-exposed. Among those exposed, we check if they have the disease or they don't have the disease, and among not exposed, we see if they have the disease and no disease. Correct? Now, what we check is that they are being assigned. So, now when it's an assigned case, we're not going to go with a case control study because we already don't know if they have the disease. So, this is following prospectively, it's not going retrospective. So, case control is ruled out. Quasi-experimental study is still possible, but it's not because quasi-experimental study is done in a natural setting. All right. Next, a cohort study is not going to have any form of assignment. It's just going to check for exposure, and then you just follow them up to see if they develop the disease or not. So, the correct option here would be a non-randomized controlled trial. Non-randomized controlled trial is the correct option for this specific diagram because you are assigning them into two groups, and at the same time, you are not going to be doing any form of randomization. So, the correct option is a non-randomized controlled trial. Question 29. Which of the following show type 1 error? So, what is a type 1 error? Type 1 error is when you assume that there is a difference when in reality there is no difference. So, your reality is the treatments are not different. So, you assume that they are different, wherein is in reality there is no difference. So, first we always follow from here, point A, and then we go to point B here. So, first we assume that they are different, but in actuality they are not different. Hence, both these areas are going to be overlapping. So, option C is going to be what is type 1 error or alpha error. Alright. Now, let's do a little bit trickery here, wherein we'll assume that there is no difference, but in actuality there is difference. So, we assume that they are not different, but in reality treatments are different. So then option B would be a beta error or a type 2 error, whereas here this would be an alpha error or a type 1 error. I hope that's clear. All right. And in case the treatments are different and the treatments are actually different, so this should show the power of the study, the ability of the instrument to truly detect what is an actual change. So the power of the study is mattering here. Next, this is question number 30. Which of the following diseases don't follow this phenomenon? Now, this is very clear. We know that this is an iceberg phenomenon. That means that there are visible cases with clinical illness, and there are definitely asymptomatic infections where are the invisible cases or the carriers. Now, don't follow. So, we are checking at what don't follow. So, we know that diabetes, unfortunately, India is the diabetes capital, and there are so many who are undetected. That's very clear. So, this does follow the iceberg phenomenon. So, that's rolled out. Next, we have typhoid as well. The infamous story of typhoid Mary, as she was a carrier, and then there are those who are symptomatic as well. So, this again follows the iceberg phenomenon. Next is dyslipidemia. Just like any other non-communicable disease, a lot of it is not detected because patients don't come in for treatment. So, dyslipidemia is going to be what is the answer in this case of the one that still follows the iceberg phenomenon. Answer finally is going to be measles, because those who get the measles infection are going to be infective and they're all symptomatic. So, measles here in this case is going to be the final answer for this iceberg phenomenon of disease. So, we have wrapped up about these 30 questions. We just gone through it briefly, try to understand what goes behind all of these images, make sure that we revise them frequently, and in due course of time, you'll be able to give a very quick response in a way that it's almost going to be a muscle memory kind of situation for you. So, I hope you understood and liked this video. Thank you so much for your time. Take care.